Democratic Opposition.
Thank you very much, Mr. Speaker. This PC government can't be trusted to look after Alberta's seniors. Several years ago, an Auditor General's report concluded that Alberta's long-term care facilities were so short-staffed that in some cases seniors had to be awakened as early as 3 a.m. in order for the staff to feed them. In the last election, this Premier promised that there would be no service cuts. This budget cuts long-term care by $52 million. My question is to the Health Minister. Why has this government broken its promise to our vulnerable seniors yet again?
Well, Mr. Speaker, I don't know where the honourable member is getting this information. I can tell you that a media report in the Calgary Herald was incorrect. In fact, my understanding from Alberta Health Services today is they will be increasing funding in home care, in long-term care, and in community-based care.
Thank you, Minister. Honourable Leader.
Very much, Mr. Speaker. Well, Mr. Speaker, this government has a long record of cutting publicly funded long-term care spaces for seniors and replacing them with so-called continuing care that charges seniors extra for nursing care. Many seniors need the medical care provided in a long-term care facility not available in assisted living. Thousands of seniors are suffering at home without the care they need or occupying acute care beds needed by other patients. Will the minister commit today to reverse the mean-spirited cut to long-term care?
Honourable Minister.
Mr. Speaker, so obviously the honourable member wants to talk about the difference between long-term care and designated supportive living. Mr. Speaker, of all Albertans waiting for placement in continuing care today, 15%, only 15%, are estimated as requiring long-term care based on assessment. What's more, Mr. Speaker, we have the ability to meet those needs over time. All of the continuing care spaces we have opened, Mr. Speaker, are built to a B2 standard. It's what allows us to provide an enhanced level of care to citizens as they age in their own community, very often with their spouse. Mr. Speaker, that's what progressive continuing care is about.
Honourable Leader.
Mr. Speaker, 15% of seniors is a huge number, and this government is cutting long-term care. They promised in the election to increase the number of long-term care spaces by 1,000 per year over the next 5 years to meet the needs of Alberta's aging population and changing demographic profile. Breaking this promise is a betrayal of the seniors who need those spaces. Will the minister admit that the Alberta Health Services budget is just another broken promise from this government?
Mr. Speaker, 15% is a considerable number, and 100% of people waiting for continuing care is also a considerable number. That's why, Mr. Speaker, we are meeting our commitment to open 5,000 additional continuing care spaces over 5 years. We are building those spaces. Mr. Speaker, to the B2 building standard, which is the standard required for a nursing home environment. And that, of course, Mr. Speaker, is what allows us to meet the promise that we made, which was to allow Albertans to age in place in their own communities wherever possible, close to family and friends.